Okay, hi, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything you see is magnified about 30 or 40 times on the screen. And we're just now putting our shaver, and we'll turn the brightness up a bit. And right away here we can confirm that that biceps tendon is torn. We're going to need a number 1 PDS marker stitch because there's the rotator cuff tear that we're going to be fixing with a suture anchor. But we can also confirm now that the biceps tendon is already torn. You can see the stump of, hold the camera right here, 2 hands. We can see here's the stump of the biceps right here. Okay. Okay, so the rest of this labrum looks pretty stable. We're now going to go ahead and get to work in just a minute in the subacromial space where this rotator cuff tear is. You can see it right here. Okay. The only other real remarkable thing here is that the glenoid is somewhat arthritic. You've lost a little bit of cartilage, but not too bad. Okay, so now we're up above the rotator cuff. This is the kind of the top-down look, or a view from what we call the subacromial space. We've already done a little bit of our decompression here. That's the acromion bone at the top of the screen. Your clavicle is going to be right over here. And we put a little marker stitch in so we could find the tear very quickly on this side because we know it's a articular-sided tear. And sure enough, there's the tear right underneath that marker stitch. And so what we'll do next is just unroof the tear by pulling the marker stitch. Go ahead and pull that stitch. Just pull it. And then we'll just unroof the tear right here. And if you keep watching, you'll see how with just a little bit of shaving, we're all the way into the joint pretty quickly. You can also see how this part of the tissue has remained inflamed and irritated. And so there we are, showing you that once we do a little bit of debridement, that tear is actually quite a bit more extensive than it would look if we were just looking from this bursal view. And that's why we use the marker stitch. So we'll keep working here and identify exactly how much of this we need to repair. Okay, so here's the tear. We're just using this marker stitch to plan our suture anchor place, and we're going to place the anchor right about here. We'll show you some more in a minute. Hold the camera here. Okay, so we're done with the rotator cuff repair. We can pull back and show you that over here. So here's the top surface of the cuff. You can see our sutures, 1, 2, and 3. And that looks very good. When we move to the right, this is where we've been looking for the biceps tendon. And we opened up the biceps groove here. That's what you see there, and the tendon is way gone. So it's actually either completely gone or retracted all the way down to the muscle maybe, because we're not seeing it anywhere close to where it normally sits, even when it tears. So none of that, what we're seeing, none of that is tendon tissue. That's hard bone right there. We'll keep looking here a little bit longer, but otherwise I think we're going to call this a tenotomy and get you back to the recovery room shortly. Okay, so we're done. That biceps was non-functional anymore. We couldn't really stretch it back anywhere. It was hard to even identify it in the groove, again, which is way over here. So we're going to finish up and get you back to the recovery room shortly, okay? This ought to do the trick for you. Good luck to you now. Bye-bye.